onto infarct. First, we're going to talk about indicators of acute infarct. And it's going to be ST elevation and the equivalent to ST elevation. ST elevation typically is occurring hours after infarct. It's not a couple of minutes, and it's generally not days. So you're talking about hours after the infarct starts. Significant ST elevation in leads V2 and V3 is different from the other leads because you see ST elevation in leads V2 and V3 with a lot of other conditions. It's more stringent criteria. So there has to be 2 millimeters or greater ST elevation in males, or greater than or equal to 1.5 millimeters ST elevation in females. In the other leads, it's just greater than or equal to 1 millimeter, and that's in at least 2 contiguous leads. Another equivalent to ST elevation is new or presumed new left bundle branch block. So if somebody's got left bundle branch block and you don't know if they had it before and they're having classic chest pain or symptoms of myocardial infarction, then you assume an ST elevation equivalent and assume they're having an acute myocardial infarction. ST changes of acute infarct are typically accompanied by reciprocal ST depression, but not always. So that just means there's ST depression in other leads. Let's look at some examples. We see ST elevation in this ECG V1, V2, V3. It's quite pronounced. Those are the anterior leads and the septal leads. There's some reciprocal depression over here, slightly. It's not super clear, but there's a little bit of ST depression in the inferior leads. Bottom line is there's big time ST elevation anteriorly. It's also present in V4 here. And so we're going to call this an anterior ST elevation MI. I guess you could call it anterior septal because V1's involved, but it's mostly anterior leads. This one's a septal ST elevation MI. It's less than a millimeter there. It's about 2 millimeters there. Close enough. This patient actually was having an ST elevation MI. Lateral ST elevation MI. There's about a millimeter here in one, about 1.5 millimeters in AVL, a millimeter in V5, and maybe 1.5 millimeters in V6. Lateral ST elevation MI. Inferior. This one's got big juicy ST elevations inferiorly. And then inferior MI is the classic for reciprocal change, which is typically seen in 1 and AVL, and you can really see the ST depression there. Okay, so we looked at signs of acute infarct. Now we're going to look at indicators of old infarct. Q waves are the main thing in level 1 that we're going to learn about. So a significant Q wave is greater than or equal to 1 millimeter in depth, and it's greater than or equal to 1 millimeter wide. And it should be present in 2 contiguous leads. Small Q waves are normal. So here's an example of a small Q wave over here. There's a P wave, and here, small Q wave. It's less than 1 millimeter wide here. So that would be normal. Lead 3 very frequently has an isolated Q wave. This example over here shows what would be considered a significant Q wave. In lead 1, it's more than a little box wide and definitely more than a little box deep. And you got this similar looking Q wave over here in AVL. So those are examples of significant Q waves. How about some examples? Old anterior MI. There's a Q wave in lead V3. You might say, oh, doc, look at the little R wave there in V3. That's not a Q wave. And we could argue about it, but it's close enough. The same goes for V2 here, where there's an itty-bitty R wave. So technically this isn't the greatest example, but it's close enough, and I would consider this a possible old anterior infarct based on the appearance of V1, V2, and 3. The old lateral MI, that's from the example above. Q waves, more than a millimeter wide, more than a millimeter deep. Old inferior anterior and lateral MI. Q wave, I guess that's a Q wave. Definitely Q waves here. This is a very abnormal EKG, and there's a very high chance that this patient has had a prior infarct. Old inferior septal, Q wave more than 1 millimeter wide, more than 1 millimeter deep, and 3, and an AVF, and then V1 and V2 have clear Q waves.